Bismillahirrahmanirrahim. In this video, we are going to talk about ammonium biurate or urate crystals. This is a very important lecture, and in it, we have a few, two or three important things to be understood. So let's begin with ammonium biurate crystals. They basically form in neutral to acidic urine. uh, the indications for these crystals to form is number one, liver disease. Basically, all those animals with like any liver disease or portosystemic vascular anastomosis, I hope you know what is this. In such conditions, there is increased urinary ammonium output due to increased ammonia load. Like liver is unable to process all that ammonia into its final product of uric acid, and that's why there is increased ammonium output, and that will lead to ammonium urate or ammonium biurate crystals in the urine. So basically there is an increased ammonia. The other indication is a specific breed Dalmatians that are predisposed to these crystals. Normally in dogs, what happens that urate is converted to allantoin, and that allantoin is excreted from the urine. But Dalmatians do not convert urate to allantoin. Basically, they excrete nucleic acid metabolites as insoluble urate. So, in Dalmatians, the process stops over here. Like the ammonia or like all those that nucleic acid metabolite is converted into urate, but urate is not converted into allantoin and excreted. And you should know that urate is an insoluble compound, insoluble element. So, what will happen? It will precipitate in the urine to form ammonium urate crystals, and this is a normal physiology of Dalmatian. This is not due to like reduced uricase activity in the body. This is like Dalmatians have this like condition not because their liver is not functioning or like uricase enzyme activity is disturbed. No, they normally have this physiology that in their body less urate, almost 30 to 40% is transported to liver, and 90% transportation should be done like in other breeds. In other dogs, 90% of urate is basically sent to the liver so that liver can process it to allantoin and it is being excreted. But in Dalmatians, only 30 to 40% is being excreted. So that is why urate is excreted as an insoluble compound, insoluble urate, and that is that is how ammonium biurate crystals are being formed. So, as Dalmatians are fed high animal protein, there will be increased urinary ammonium levels, and as ammonia and urate concentration increases in urine, increase stone formation. So, simple thing: you are feeding your Dalmatians high protein feed, and ammonia will increase. Ammonia will increase, and there will be like also already urate concentration is high in those Dalmatians. So urate stone formation will increase. So while feeding this high animal protein to Dalmatians, you should be vigilant. You should know that your dog is already having high urate, and you are already like you will, if add on you are feeding high animal protein, that will increase ammonia too, and these two will combine and form ammonium urate or ammonium biurate crystal. So be vigilant on that. Basically, as far as their appearances is concerned, they are yellow-brown spheres with irregular spiny projection, just like torn apples, and they may be amorphous. In previous lecture, we talked about basically amorphous urate crystals. Now we are talking about ammonium urate. In previous lecture, we talked about amorphous urate. So these crystals may also look like amorphous too. So you should know. And if you are seeing this diagram, you can see they are spheres, and along with their spheres, they are having these tiny projections, irregular spiny projections, these projections you can see. So they have these spiny projections. Next we have is their dissolution and prevention protocols. Number one thing, in the previous slide, you have seen that it forms in the acidic urine, so you should try to adjust the urine pH, convert into the alkaline or basic pH by feeding potassium citrate or orally sodium bicarbonate. Potassium citrate is preferred because of its palatability, and when you will feed this, the renal ammonia production will decrease, and you will be having like all those prevention or treatment protocols done. Next, you should feed low protein. And number third one is allopurinol, use of this compound. uh, First thing, that in the previous video when we talked about amorphous urate crystals, I talked about allopurinol there too, and I said that I will discuss the detail of this drug in this lecture. So here is your like that concept we left behind in the previous lecture, because it is more related to these crystals. Basically, for the as for prevention or dissolution prevention protocols, you or treatment protocols, you can feed your animal, have Dalmatian or animal having these crystals, allopurinol. What is allopurinol? It is a xanthine oxidase inhibitor. Now what does it do? Normally, nucleic acid metabolite is converted to hypoxanthine in the body, and hypoxanthine is converted into xanthine, and that xanthine is converted into uric acid, and uric acid is then converted into allantoin and being excreted from the body. Now, you know, in your Dalmatian, uh, normally it is not converted into allantoin, and the cycle ends over here. The cycle ends over this uric acid. So already you know you have increased uric acid in your dog. So you will feed this allopurinol, and what does this allopurinol does, that it will decrease uric acid by inhibiting xanthine conversion to uric acid and decrease too. So it stops basically this cycle. Let me change the color. Okay, it stops this cycle over here. It does not let xanthine convert into uric acid. So there will be bit of increase xanthine in the body of animal, but there will be decreased uric acid and decreased ammonium urate crystals. But here there is a caution you should be aware of, that if you are feeding or administering allopurinol to your animal without decreasing protein diet, that may lead to increased formation of xanthine, and that xanthine will then start to precipitate and start to form xanthine stone. Then you are going to have a different issue, that you have shifted your ammonium urate crystals problem to the xanthine stone problem. So if you are feeding allopurinol, also do this, that decrease the protein diet of your animal, because otherwise if you do not do that, xanthine production will get increased, and xanthine will form xanthine stone. So be aware of that. I hope you have grasped the idea and you are not like more confused. So that was all about the uh, these crystals, ammonium urate. So thank you guys for watching these videos, and do subscribe the channel.